Good evening, I am Dr. Akl. I am cancer specialist in Flint. Today's topic is how we treat cancer. Basically, cancer is treated by three main modalities: either surgery or radiation or chemotherapy, and there are other categories. We will allude to it during our talk. Again, it depends on the type of cancer, the stage of cancer, and so on. So for our patients, they need to be screened for cancer of the cervix if they are young female with pap smear, and for women above the age of 50, they need to go under yearly mammography, and for men for colorectal cancer when they are above the age of 40 by stool for occult blood. Those group of patients, they are normal. However, the other patients, when they have symptoms like cough, bleeding, and so on, they need to be seen and followed up. I like you to know that not necessarily these symptoms indicate cancer, but you need to be careful. Symptoms, especially if they persist, I need to make sure you don't have cancer. I'm not saying if you cough you have cancer or if you bleed you have cancer. No, but you need to be on top of things. In case if you have cancer, we will hopefully diagnose it early. The sooner we diagnose cancer, or the earlier you diagnose cancer, the earlier you get earlier stage and higher chance of cure, of course, in a big number of cases. So if someone diagnosed of cancer, number one, they don't need to panic. Or if someone has symptoms, they need to go directly to their doctor. They don't need to worry that the answer might be cancer and not see their doctor, because even nowadays you have cancer, we cure it, God willing, with permission of God. Many cancer is curable, and good chance of having a good lifestyle. So once you know you have cancer, you don't need to panic, worry. No, just have faith in God and follow up, get what type of cancer and staging. We need to know whether this cancer is localized, spread to the lymph glands, spread distally. I also wanted the patient to know that even if the cancer spread many times, or many type of cancer like lymphoma, for example, it could be in more than one area spread and still a good chance of cure. So we do not need to look at whether this cancer is early or late and so on, because many variables. Certain cancer, even when it's spread to the lymph nodes in young patients, like for example thyroid cancer, they do very well, and their life expectancy same as they don't have cancer. So there are many variables. So you as a patient do not need to panic when you get cancer. Of course, that's not good news, but sometimes it is good news, especially if you cure it and good cancer, early stage, and so on. So this is very important, because keeping your appointment, be cooperative in doing the tests, and be perceptive to understand pros and cons of each treatment, staging, and so on is so crucial, because cancer treatment is team. The patients interact with a team of physicians: the surgeon, the radiation doctor, chemotherapy doctor, dietitian service, social worker, and so on. Is a group of people sit together to decide what the best course of action for you. So doing it this way, you as a patient get all benefit of the doubt and get the right answer and it is your right that your physician explain to you benefits versus side effect of treatments, also alternative options. For example, if you have cancer and the option is to remove it versus to give radiation versus to get chemotherapy, those need to be cleared by your doctor and well explained to you, and you as a patient need to give the decision. Of course your doctor will help you. If for example you have 50% chance of cure if you go for surgery, if you got equal chances if you go for surgery or for radiation or surgery or chemotherapy or radiation, if you have equal chances, sometimes your doctor tell you yes, you could go for surgery or you could go for radiation or chemotherapy, but you as a patient could give some input. That's still helpful. We must tell you the benefits versus side effects in details, and you pick the treatment. If you ask me my opinion, then I tell you yes, I like this because of blah blah blah. However, if you choose this is not wrong because of 1, 2, 3. So it is a teamwork. Patients need to be well informed, and sometimes elderly patients don't understand very well, and they have difficulty to decide, and so on. So whoever near to them, their children, their spouses, family member, and so on, need to be part of the decision making, and that would help. Again, you need to know that whether you go for any treatment, some treatment are very difficult. Patients don't want to have too much side effects. Some treatment is much easier. Nowadays, even if the treatment is difficult with medications and with different regimen, treatment today is easy. For example, in radiation, in the old days 10-20 years ago, radiation treatment used to be crude, and instead of irradiating a smaller area, we irradiated bigger area simply because the equipment were not there. Today is totally different story. Those patients, for example, with prostate cancer, when they undergo radiation treatment, is limited to the prostate, minimum radiation somewhere else. So patients go through the weeks of radiation with almost no side effects. So the technology helping make life much easier for you as a patient and for the team who work in your case, that make it so easy. Technology is kicking in. New options are available. So you are as a patient, once you diagnosed of cancer, please do not panic. Wait until diagnosis is done, staging is done, understand your options, then see what is your chances, what's the best treatment, what kind of side effects, and you will be happy.